Dr. Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about chronic pelvic pain. So, chronic pelvic pain has many potential causes, and there are some other videos that touch into them. So one of the most common is called endometriosis. You can see that video separately. You can have pelvic adhesions or pelvic adhesive disease that can cause discomfort. You can have digestive problems or constipation or diarrhea or problems with your intestines that can cause them. So we're going to touch into some of these reasons, not give you an exhaustive lecture, but give you a few of the potential causes, and then give you some advice on how to keep track of what's going on with you to help sort it out and provide that information to your obstetrician gynecologist or your physician who will be addressing your problem. So if you have pelvic adhesions, then that can potentially cause some discomfort. So what is a pelvic adhesion? Well, if you were to take a potato peeler and skin your finger and your thumb and then touch it together and let it heal, it would stick together. That would be an adhesion. Things stuck together that aren't supposed to be. Now, if my hand were adhered and you took a picture of it, you'd have no way of knowing whether it was stuck together or just touching. And that's why we can't see pelvic adhesions easily on ultrasound or CT scan or imaging tests. There are some tricks to get it to move that can help, but by and large, you can't really see them. Now, if I were to go and use a scalpel and cut this and then let it heal, it would be better. I'd get back my function. However, I'd have a teeny little scar here and here, so I'd always know it was there. The point is, adhesions are scars, and there's a way to get them significantly better, but you can't totally eliminate them. So what causes adhesions? Well, you can have adhesions after surgery, about a 10% risk of a laparoscopic surgery and open surgery, any abdominal surgery. How do you fix adhesions? You do a surgery, so they have a small risk of recurrent adhesions. Okay, if you get an infection after your surgery, especially, that can increase your risk. Or if you have pelvic inflammatory disease, so sexually transmitted infections like gonorrhea and chlamydia especially are common, that can, especially the longer you have them, can cause pelvic adhesions that can lead to chronic pelvic pain, even if you've gotten those treated. Okay, constipation can lead to pelvic pain and can be very close to your ovaries and tubes, especially on the left side, and can make you feel like you have female problems, but maybe you have digestive problems. So one important thing to do is track your pain from your physician, to provide for your physician is what I'm saying. When you have the pain, how long it lasts, and track your periods, and let's correlate when your period timing are to when you're having the pain, and also when you're having your bowel movements, and that will help us sort it out. So keep a calendar of those separate events, and then we might be able to see a trend or make a correlation. So let's talk about endometriosis, and I do have a separate video for that, but basically when the lining of the uterus somehow gets into the pelvis, it gets thick in preparation for pregnancy, and it bleeds, but it bleeds internally, which can cause scarring, damage, and adhesions. Okay, you can't see endometriosis on an ultrasound as well. For somebody who has chronic pelvic pain where no imaging test discovers a cause, 70% of the time it's endometriosis. What's another cause of pelvic pain? Ovarian cysts. Now, I constantly hear women concerned about ovarian cysts. Most ovarian cysts are normal. The normal functioning ovary makes a cyst every month, and that's the function of the ovary. It makes a cyst, and at time of ovulation, out pops an egg. That's how you get pregnant. So if you're having ovarian cysts, that demonstrates that you can get pregnant and that you're a normal functioning fertile woman. Now, there is a term for that, and that when the cyst pops, it can hurt. That term is called Mittelschmerz. It's a German word for middle pain, mid-cycle. When you have the worst pain, you have generally speaking, 2 weeks later is when you have your period. So if you keep track of the pain and you notice, wow, every time I have the pain, 2 weeks later I have my period, that helps narrow it down. That's one of the things that the birth control pill suppresses. It suppresses ovulation, so it helps treat that pain. And so it's often a first-line intervention to help with chronic pelvic pain or the pains that go with the menstrual cycle. You might always have pains during your periods. That's what we call dysmenorrhea. Those are painful periods. That's a little separate, but I wouldn't call that chronic pelvic pain. So getting an adequate assessment of when the pain is occurring, what makes it worse, what makes it better, does it get better, what does it get better with Advil, ibuprofen, Tylenol, change in position, does it have any correlation to your diet, does it have correlation with sex, does it hurt more when you have intercourse, or is it totally independent of those? Those are some factors that help us narrow down the cause of your pain and what interventions that we can do to help improve them, like surgery or medications or change in diet. Okay, so this is just an overview of some of the things to think about. It doesn't tell us exactly what's going on with you. Just give you a little bit of background and information so you're armed with more information when you go and see your provider. And I encourage you to go see them because we can often make it better. I hope you found these comments helpful. Please leave your comments. Thank you.